couple of points to keep in mind here. Number one, it's been a pretty different year in terms of how these processes normally work. There's normally a very tightly regulated timeline at which all of these decisions take place. Things like the ACIP decision, the FDA label change, all of these usually happen in a very organized, cohesive way. That did not happen this year. And it's also crucial to understand that some of the changes that were made, so for example, the changes to the CDC language, the changes to the FDA label, were not based on data. They were not based on new data that was concerning about vaccines. These were sort of made outside of the normal scientific process. And so Michigan, along with many other states, has chosen to go with national medical organizations in terms of our vaccination recommendations. So we've got organizations like AAP, the American Academy of Pediatrics, and ACOG, the American College of OBGYNs, that have issued strong recommendations about vaccinating children and pregnant individuals. Both of these organizations still support broad vaccination. And so Michigan, like many other states, is following those national organizations that are really following the science and the data.
And how might this conflicting guidance from agencies and organizations like the AAP impact public trust on vaccines?
I think that it has a real potential to erode public trust. People are just hearing so many negative things about vaccines and so many confusing things about vaccines. It might make people think that the data has changed. And actually, when we look back at the data from last year, for example, just looking at last year's strain of the COVID vaccine, that particular vaccination was very successful at reducing COVID-associated emergency department visits. It reduced them by about a third. It reduced COVID-associated hospitalizations by more than half. And so the vaccine, the data around the vaccine is still very, very good. And I think that it's unfortunate that some of this political rhetoric is now impacting the public trust.
What steps is MDHHS taking to communicate vaccine guidelines to the public and providers?
Well, this is an executive directive, so it's a little bit different than an executive order. This is directing her state governmental departments to take certain actions. And some of those actions we've already started doing. We've already had conversations with clinical providers in very large forums. We've had conversations with pharmacies to try to, again, make sure that vaccines are available and effective. But what this executive directive does is it really sets a tone and a direction that now not only the Michigan Department of Health and Human Services, but that LARA and DIFS can now work together towards a common goal, and that's vaccine accessibility. This is not a direction that is forcing anyone to get vaccinated who doesn't want to be. This is not a directive that is imposing any beliefs on anybody else. It's simply trying to make vaccines accessible for those who want it and those who don't have a contraindication.
And are you able to clarify exactly how the state is going to ensure agencies like MDHHS and DIFS and LARA comply with the directive from the governor?
These agencies, so I'm representing the Michigan Department of Health and Human Services here today. Our plan is to work closely with LARA and with DIFS and to come up with a comprehensive, collaborative plan, again, to make vaccines accessible.
We talked a little bit about vaccine hesitancy, vaccine skepticism, and misinformation, especially coming out of the CDC and RFK Jr. Now, how is Michigan countering vaccine misinformation and COVID-19 misinformation?
Well, part of this is that people are really confused about the guidance. And so one of the first things we did in August, in fact, was issue some very clear guidance, what we recommend for COVID-19 vaccinations, the fact that we align with these national medical organizations. And so that has already been issued, but we will continue to issue guidance so that people have no confusion about where we have landed. And again, our goal as the Department of Health is to follow the science and to make sure that we are making our recommendations fully grounded in the scientific evidence that's available.